It's 7:30 in the morning, you're already late for work, and your 7-year-old is suddenly on the floor, clutching their stomach, refusing to put on their shoes for school. Or maybe it's a sudden, explosive meltdown over a minor bedtime routine. In the middle of a separation or divorce, moments like these hit a parent hard. The immediate reaction is almost always a spike of panic, closely followed by a heavy dose of guilt. The creeping fear that somehow you have failed them. The instinct is to treat what we can see. We check for a fever, offer a heating pad, or discipline the refusal away. But the stomachache persists, and the meltdowns keep happening. That is because the child is not actually sick, and they are not misbehaving. They are reacting to the reality that the entire foundation of their world, the structure of their family, is shifting beneath them. Young children simply do not have the emotional vocabulary to articulate existential dread. When a child cannot put their overwhelming fear into words, their nervous system takes over, and their body does the talking for them. To navigate childhood anxiety during a family transition, we have to stop acting like doctors treating a physical illness and start acting like translators decoding a hidden language. Clinginess and separation fears translate to the unarticulated question, who will take care of me? Falling grades or irritability carry the internal worry, is this my fault? And physical symptoms mask painful loyalty conflicts, asking, will I have to pick a side? Once you translate the behaviors into these underlying questions, a vital truth emerges. These reactions are a deeply normal, entirely human response to a major life upheaval. They are proof that the child is processing a massive change, not evidence that they are inherently fragile. The reassuring reality is that the human brain is highly adaptable. With patient, steady support and reassurance from caregivers, most children navigate these massive changes and settle into their new normal over time. But there is a clear dividing line between the standard bumps of transition and something more serious. That line is crossed when the anxiety lingers for months, intensifies over time, or disrupts daily life, like consistently destroying sleep or making school attendance impossible. When a child's distress crosses that specific threshold, it is a clear signal that the subtext has grown too loud for the family to manage on their own, and it is time to bring in professional support. Recognizing this distinction between temporary adjustment and disruptive anxiety empowers parents. It removes the guesswork and provides a clear trigger for when to step back and hand the decoding process over to a trained clinical translator. That translation work is driven by evidence-based care, specifically child-focused cognitive behavioral therapy. Licensed clinicians use this framework to identify the root fears driving the child's physical symptoms. The therapy builds concrete coping skills, providing the child with the specific vocabulary needed to ask those terrifying questions out loud and the mental tools to process the answers. This individual work is paired with an integrated family approach. Therapists guide caregivers on how to actively reduce the ambient conflict in the home and provide the specific, steady reassurances the child needs to feel physically and emotionally safe. Clinical intervention validates the child's internal experience. It replaces unvoiced panic with open emotional communication and restores a sense of safety and worth that stabilizes the entire home environment. Delivering this specific care requires modern infrastructure, which is exactly what MentalSpace School provides directly within Georgia's K-12 education system. They strip away the traditional friction of waiting lists and clinic commutes. Dedicated teams of culturally competent therapists are available for same-day teletherapy sessions right when a student is in distress. The financial barriers are also cleared away. The platform accepts a broad range of major insurance providers, and for students covered by Medicaid, the cost of care is $0. This chart illustrates the measurable results of that care. With this structured intervention, students see an 89% improvement in school attendance, a 92% reduction in anxiety, and an 85% rate of overall family satisfaction. A family transition brings inevitable stress, but the distress does not have to become a permanent fracture. With accessible clinical support systems in place, a child's hardest moments can become the exact foundation where they build deep, lasting resilience.